today's focus is on settings for community health nursing. So last but not least, and man, I wish I was tall like that. Tammie.
You'll be all right. You will be one day.
Oh, maybe I will.
You'll get there.
Tammie Payne, who is a parish nurse at Boones Creek Christian Church, and I've actually had one of my senior groups there this semester. So when you all come tomorrow to look at the posters, you might want to migrate over to the group that worked at Boones Creek Christian Church with Tammie. So a very different type of nursing.
Definitely different than yours.
Coming behind corrections.
Yeah, I don't know.
How that worked out. But go ahead.
Oh, I am Tammie Payne, and as she said, I'm a registered nurse, and I also graduated from ETSU way before internet. And I was just listening to Deb when she said 32 or 31 years. I'm thinking, oh, that's how long it's been for me. It's 31 years. I graduated in '85. And I started working as in 1984 as a scrub tech in labor and delivery. And that's where I wanted to go. I love labor and delivery. And so I got to scrub in on the deliveries, go in for C-sections. It was back in the day where you sterilized the instruments. I had to mop the floors. I felt like Carol Burnett every time I would take that bucket into that labor and delivery room. It was like an OR room, not the nice rooms that we have now. But I worked in labor and delivery for about 13 years, and then due to some health reasons, I had to leave that job. And then, but like I say, in labor and delivery, I loved it. It was either, everybody said, oh, it's the best place to work. I said, well, it is. It's either the best place or the worst place. Everybody expects a healthy baby, and that's what we want. But then there's those times when it doesn't all work out that way. And you know, my worst nightmare was my best friend from a long time ago, and been friends, called me up one day, and she was like a week overdue, and said, Tammie, I hadn't felt my baby move in a couple of hours. And I had worked night shift. It was 12 o'clock. You know, I was in that good sleep, and I, you know, was talking to her, and I said, well, you know, drink you something and lay back down for an hour, and I'll give you a call back. You know, and I guess then the Lord just said, you need to wake up. So I went and picked her up. She had called her husband. I said, no, I'm going to come get you. We're going to the hospital right now. And we got there. There wasn't a baby's heartbeat there. And that's the worst thing when you go in there to that room and you put that monitor on that lady's abdomen, and you know, you can't hear that heartbeat. So that was pretty sad. And that's not the first time that happened. I had another friend, but those are just times where I was able to share my faith with those people, and hopefully with everybody that comes through the doors. But you know, it takes a lot to get through that. But most of the time, like I say, it was a happy place. I got to deliver some babies. Those doctors, you know, they're not in the hospital 24/7. So ladies come in, and either they were ready to deliver right then, or they ended up going a lot faster than we anticipated. So it was a great job. Loved it. And then I went to work in women's health, the breast care center, and where I worked there with ladies that were coming in. It was funny. I saw these ladies have their children, and now they were coming for their mammograms. So it was a good little transition. And but there I did assessments on patients that were getting ready to have procedures, biopsies. I was with these patients when the doctor brought them back to give them the news of whether they might have breast cancer or not. Worked with a lot of resources, getting them to doctor's appointments and helping them get that set up. So. And that was a great job also. And then later on, I just got to where I had rheumatoid arthritis at an early age diagnosed. So then I just got to where I couldn't continue working at that pace. So I was off work for about 4 years. And then some friends of mine said, Tammie, you should do parish nursing. And I was like, oh, I don't know. I felt like I really didn't know a lot about everything else because I had mainly worked labor and delivery for so long and women's health. And but I went ahead and started that in 2004, so I've been at Boones Creek Christian Church for 12 years. That's my home church. I grew up in that church, so it's been a great for me. I knew a lot of the people and coming into the job. Our minister had just been there, a new minister for 1 year, and he had a parish nurse in Florida. So when I approached him about, you know, maybe being a parish nurse at the church, he was all for it. So it was a great transition. Parish nursing is not a job that you do for money. And I do this as part-time. I do get paid through my church, but like I say, it's more of a ministry for me. And it is through also Mountain States Health Alliance. They have the parish nurse program. And so there's like 26 parish nurses in this area. And we get together once a month. We have programs, educational programs, and we share ideas of what we're doing in our churches. We are mainly a ministry of presence, and that's what we all sort of take that as our motto. We do not do a lot of hands-on stuff. Mainly is blood pressures, and I carry me one of them little pulse oximeters in my pocket too, and do a lot of blood pressures. But as far as home health, stuff like that, changing dressings, giving shots, doing the PICC lines, those patients have home health. That's what they're for. And we're there to encourage or help them along. I go a lot when they're teaching the patient because I do a lot of education also. So I try to be there when home health's going to come out or something like that and go and be there with them. We can also, you do have to be a registered nurse to be a parish nurse. But we can also talk with physicians. We're sort of can be a liaison between the patient and their doctor. So when I go see patients at the hospital, if the patient says it's okay, I can talk with her nurse about her care, what her labs are, what her x-rays showed, what her plan of care is, when she's going to get discharged, where she's going, to help sort of with that. And we can also talk with physicians. And it's my typical day. Usually, we always start our church, the staff does, at 9:10 with prayer for people in our congregation for needs. And after that, I'm usually off to the hospital, as in, like today, I'm always going to the hospital, it seems like. So on my way here, instead of coming and getting on the interstate like I would to come to ETSU, I'm going off to the hospital. And I realize I'm not going there today. Need to get back on. So that's really where my car goes all the time, is to the hospital. But I like to visit the hospital. I feel like at that point, since I've worked in a hospital, that I can help patients get around the system. If you don't have a family member with you now, sometimes it's hard to know what to do and how to ask questions. So a lot of times, if we're sitting in the OR waiting room or the ICU waiting room, I can help orchestrate some of that and getting back to talk with the patients, to the doctors, step after procedures. I also see a lot of people in their home. When they go home from the hospital, I always like to be there within 2 or 3 days, usually 2, hopefully, and just go over that discharge instructions that you get when you leave the hospital, and it tells you what medicines to take and what you're supposed to be doing, when your appointments are. I try to go over all that. You'll be amazed that when people come home from the hospital and that list of medicines you give them, sometimes is not correct on there. I had a patient that the doctor had marked for him to take, not to take his Coumadin anymore. Well, he needed that Coumadin. And so he's like, I don't know why he stopped that, but I guess, and people, they just take whatever the doctor says, a lot of times, and they don't question that. So I'm a big patient advocate too. So, I ended up calling the doctor, and he said, oh, you have to call this other doctor. So after about 3 or 4 phone calls, we found out, yes, this man still needs to be on his Coumadin. So do a lot of education and teaching. I also go with patients to the doctor's office. I went, and sometimes you just don't know what you're going to get into when you go there. So one man I went with, he was an older gentleman, about 70. Could have been my dad. And we got there, and so they said, they thought that I was his wife. And so I'm like, no, I'm just the church nurse, So, but you get to go, I go with patients to their appointments, help them understand what the doctor's talking about. Go to nursing homes a lot, visit our shut-ins. And visiting the shut-ins is one thing I love because, you go there and you're hoping that you're going to encourage them. But they always end up encouraging me. And that's the great part of that, about that. Oh, let's see, I do blood drives. Right now I'm getting ready to do this Sunday. If anybody'd like to come, I'll throw a little plug in here. We're doing a bone marrow drive and a blood drive. We have a 4-year-old in our church that was just diagnosed with cancer, bone marrow disease, and he is going to be having a bone marrow transplant. He is at St. Jude's in Memphis right now. We've been down there 2 times to check on him. But anyway, so we're having a bone marrow drive from 11 to 3 at our church Sunday, and the best candidates and that they like is 20-year-olds. But you have to be between the ages of 18 and 44, and it's just a cheek swab is all they do to start the process. So if anybody wants to come and be a part of the bone marrow registry, we would love to take you. But so we get into a lot of situations where you're with families that get bad news. And I had just gotten to the hospital when this mom was told that what her son had, and that she needed to go home and pack her clothes, be ready, get enough clothes for 2 weeks, but she would be in Memphis for 6 months. And I mean, she went home in a 2-hour span, had to get her whole life together, and leave. And it is, it's hard. Some challenges in my job, I would say, is just trying to get everything done. Our congregation is 850 to 900 people, and there's always somebody that I want to go see or visit or make a phone call to, and I never feel like I get that done. I do work part-time, but sometimes that changes. And as you say, as the need, and it may be at 3 o'clock in the morning. One thing that I do love is hospice, and that's one of the things I love the most would be being with patients at the end of life and just being there to comfort them, give them support. So I spend a lot of time in patients' home, especially if they're with hospice. And I can't say enough about hospice, so I love it. That's where I would be if I was probably working. And I would say for cultural, spiritual, and ethical, one thing that's really hard is the HIPAA laws. Sometimes I go to the hospital and a family member will ask me, will you go and see so-and-so that's in the hospital, one of their family members? Well, you get there, and the name they give you is not their name, their real first name. So a lot of times I get there and I can't find anybody that'll tell me what room they're in. And if I can't get a hold of that person, then I have to leave, and that's hard. And also, a lot of people at church, they come up and they'll say, well, how's so-and-so doing, or what's wrong with this person? And, and I just have to say they're doing okay, or, and I always ask people, if people ask me about your condition, what do you want me to tell them? Because that is a big confidential thing that we keep. And I am blessed that with this job I can share my faith, and that's what I love to do. I love the Lord. I want to serve Him, and this is how I feel like I can do that best, is to being out there and sharing His love with others. And John 3:2, dear friend, I pray that you may enjoy good health and that all may go well with you, even as your soul is getting along well. So it's maybe not the physical part that I'm helping with sometimes, but it's spiritual, and that's my love. Thanks.